Myself, Dr. Aditi PS, Associate Professor, Department of Swasthavritta and Yoga, Yenepoya Ayurveda Medical College and Hospital, Yenepoya deemed to be university. The topic for today is potential of yoga for promotion of mental health. That means how yoga helps for the promotion of mental health, or otherwise how it prevents the mental diseases. Now the objectives of today's learning are, priorly the intention is the listeners should be aware of the burden of mental disorders, especially in children, and its significant impact on physical and social health as well as economical consequences. This is the first one. The second one is they should inculcate or they should practice, they should inculcate the practices such as yoga and meditation, which are significant rather than very significant towards building complete health. So the contents are problem statement, that means what is the status of mental illness, and then the causes of the same, and yoga and determinants as per yoga, role of Ashtanga yoga, and so on. Yeah, before going into the topic, I have brought some of the statistical data which are saying or showing about the non-communicable diseases, that too in children from the age 0 to 19 years. This is from the South Asian zone. This data is pertaining only to the South Asian zone, and it was taken in the duration between 2009 to 2019. Looking at the pie diagrams here, you can see many of the colors in the pie diagrams. They are depicting the particular non-communicable diseases. Look at the first pie diagram, that there the red color is occupying the major space, that is nothing but cardiovascular diseases, and that diagram shows the data of non-communicable diseases from 0 to 4 years of children. Coming to the next one, there the colors which were having very less area have little bit occupying more space here. Our concern is nothing but about the pink color. But look at the red color, it has been diminished and giving space to the pink color. Pink color is nothing but the mental diseases. Look at that pink color in every pie diagram. It has been increasing, not decreasing at all. So that is the major concern, that the child who was 0 to 4 years, the mental diseases percentage was 4.7%, and when it became 5 to 9 years old, it rose to 22%, and then when the children are in between 10 to 14 years, it became almost 37.48 or 38%. Look at the percentage which is covering by the mental diseases, that too in children. The age in which the minds of the children should flower and flourish, rather than they are under monitoring by the family members or by the hospital, and a major portion of the child population which will be in the further years more significant one and more productive population, that is been under some of the other medication because of this mental illness. So that is in that concern the issue is being called as the burning one. And what are the causes why that fragile age is being eaten up by these mental diseases? They are the causes of mental diseases. They are classified into into three types. One is biological causes, another one is social cause, the third one is psychological cause. In biological cause, as it is very old, good old proverb says, healthy mind in a healthy body. So as to substantiate that, or so as to give more of the weightage to that, people who are having more of the physical illness, or let me call it as the debilitating diseases, or the chronic illnesses for long years, either the direct relation or direct impact of the disease itself will be there on the mind or mental health of the person, or otherwise the medications which the person is been taking since long, they will show some of the effects on the mental health of the person. For example, corticosteroids, or it may be the opioids, or it may be anticonvulsants as in case of children, or otherwise hormonal therapy and PPIs in case of the adults. Otherwise, in case talking in case of the physical health, it may be as simple as the deficiency of vitamins. Maybe for example, it may be vitamin D deficiency which causes anxiety, which causes depression, or it may be ADHD, or otherwise it may take the child to suicidal tendencies. So with vitamin B12, or it may be B6 or B9, or it may be the deficiency of the micronutrients, as it may be selenium or zinc, or it may be magnesium, manganese, and so on. These, if unattended, may have their negative impact on the mental health. And coming to the social one, here the child will be spending lots of its time either in home or in school. These are the two areas where the child will be having its more of its, or spending more of its time, and both of them, either home or it is school, both of them are having too much of impact on the child's health. It may be physical or it may be mental also. Maybe at home, maybe there is a single parent family, or it may be the crowded family, or it may be too much of nuclear family, or conflicts between mother and father, or something else. Such kind of unhealthy atmosphere for the child, or otherwise it may be in the school, some of the bitter experiences the child might have experienced in school, they will be having so much of impact on that fragile mind. While growing further, it may grow into some of the, or one or the other mental diseases. And so is with the psychological causes also. Small irritation may be grown into agitation. So the diseases which I have shown here are the common types of mental disorders. They may be 6 or 7, but the list is still big. Enumerating them, it may be depression, or it may be post-traumatic stress disorder, bipolar disorder, dementia, phobia, schizophrenia, panic disorder, and so on. Now the main question is, what is the remedy for this? Is it only the medication taken when the symptoms start exhibiting, or otherwise is there anything with which we can stop the symptoms from building in? Yes, it is nothing but yoga. Hearing the word yoga, many of you will think that it is just a physical exercise. No, it is not. Yoga is a very huge and scientific concept in its own. The very word meaning of yoga is union. Union of what? Body, breath, mind, as well as the Atma. The practices which are there here are physical, mental, and spiritual practices together. When it originated 5,000 years ago, before Vedic period in India. Why it is so? Or how can we say that? Because in the first Veda, that is the Rig Veda, there is mentioning about yoga, and in the early Upanishads also. The aim is controlling body and mind together and to attain various salvation goals. The other textbooks which came are the Yoga Sutras of Patanjali, the classical texts, and the mentioning of yoga is there in Sankhya, influenced by Buddhism, dates to early centuries of the Common Era. And beautiful texts about yoga are Hatha Yoga texts, began to emerge between 9th and 11th centuries, originating in Tantra. The all these tantras or all these Patanjali, maybe Patanjali Yoga Sutra, or it is Hatha Yoga text, or whatever it is, the main intention of yoga is bringing harmony between mind and body. Now, what yoga has to say about the mental diseases, or has it said anything about the mental diseases or how to combat them? Yes, the determinants which yoga says are panchakleshas. One set of determinants are panchakleshas, and they are avidya, asmita, raga, dvesha and abhinivesha. Avidya is nothing but the ignorance or lack of spiritual knowledge. Next one, asmita. When the spiritual knowledge is lacking, then more of I and me concept will grow. That is nothing but the egoism. The I and me factor are so much, always thinking about that. Raga emerges. Raga is nothing but too much of attachment towards, not towards everything and anything, towards only that thing or only those people who are bringing pleasure to ourselves. And dvesha, it is completely reciprocal, that is aversion or avoidance of those people or those things which are bringing pain to us. That is dvesha. Always thinking about how we will avoid that, how we will avoid them, that brings stress. And the last one is abhinivesha, that is nothing but fear of death or clinging to the life and clinging to the worldly temptations, worldly desires. So that all these things happen only because of avidya. So the panchakleshas are called as the mind poisons and obstacles that cloud the thoughts and intentions. It leads to false perception and negative emotions. So now the other set of determinants or causes according to yoga are chitta vritti. What are these? The chitta vrittis are, they are called, as per yoga, they are called as the mind fluctuations or mind chatter. Which are they? They are pramana, viparyaya, vikalpa, nidra and smriti. Pramana is nothing but it is the means to get proper knowledge. Maybe pratyaksha by our five senses, and another one is anumana, inference, and then agama, they are our granthas or the texts which we are having. They are the routes or the modes which will be taking us to the proper knowledge. Next one is viparyaya. Viparyaya is wrong knowledge, wrong perseverance of the things. Sometimes we'll be looking at the thread lying down, we may think it is some worm lying on the ground. That is viparya, that is wrong perception of the knowledge. Third one is vikalpa. Vikalpa is nothing but fantasy or imagination. We will be in the fluctuating mood, that is this or that, either this or that. This one is correct or that one is correct. This is wrong or that is wrong. We will not be in the proper or deciding area wherein we should go for this or go for that. The fourth one is nidra. Nidra is nothing but deep sleep. All the faculties, all these chitta vrittis or the faculties of the mind will be completely void in this duration. Next one is smriti, memory. Memory, pramana and nidra are some of the faculties here in chitta vritti which are actually needed for the successful life, but still they should be controlled as per the saying of yoga. These chitta vrittis, if left over, then they will cause havoc in the mind. They call them as monkey mind. The very goal of yoga is to quiet these fluctuations which can cause much stress and pain. That is why it is said as yogaha chitta vritti nirodhaha. Nirodha is not completely shutting them down, it is controlling them. That is yoga. That which controls these chitta vritti is nothing but yoga. Yes. Now what is there in this yoga, or with which part in yoga we can control these chitta vrittis, or we can deal with the panchakleshas? They are nothing but yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, samadhi. They are 8 in number. They are the 8 important limbs of yoga. First one is yama, then niyama. These two are nothing but the rules and regulations which are laid by oneself. Not by, it is not the things which are put on anybody and they should follow these. That again causes stress. They will be put on us by ourselves. They are the rules which should be followed for oneself to begin with and to sustain in the yoga. For example, ahimsa, satya, asteya, brahmacharya, aparigraha. We should be truthful to ourselves. We should not harm anybody. These are nothing but they are again bringing harmony in oneself. Then it helps the mind to be steady. The next one is asana. They are some of the physical postures which have to be attained, and then what happens with asana is exactly, you people might have experienced or seen, whenever we want to be angry on anybody, or when we were children, when we wanted to show anger and on our parents, we would go and lie in the prone position always. That is something we are not happy with, or we are depressed. That shows the negative emotion of our mind. We will never feel the negative emotions when we are lying in Shavasana. We can't do that. Otherwise, the very simple example is, when we are excited, we cannot sit in one place steadily. We'll be standing, we'll be roaming here and there, we'll be making so much of the hand movements, leg movements, all those things. What it shows is, the mind makes the body as it is inside, as the mind itself is inside. If it is too much of fluctuating mind, then our body also will be showing some of the movements. This asana, what it does is, it brings the body to some of the steady postures and says or commands the mind that you should be like this. The steady body brings mind to the steady state. This is asana. Next one is pranayama. As in pranayama, it is said that chale vate chalam chittam nischale nischchalam bhavet. The vata, that the pranayama is mainly dealing with the breath, the breathing practices. Chale vate chalam chittam. When the breath is steady, or when if the breath is unsteady, the mind is unsteady. If it is steady, then the mind also becomes steady. So this is nothing but pranayama, how it has its impact on mind. Next ones are pratyahara, dharana, dhyana. They are a little bit internalized practices. They are called as the antaranga yogas. Of course, pratyahara is the bridge between the bahiranga and the antaranga yogas. Dharana and dhyana are completely internalized practices. And the last one is samadhi, which right now it is being practiced by the yogis, because samadhi is nothing but union of Atma with Paramatma. So these are the Ashtanga Yoga, and these are the practices wherein it has its positive impact on mind. So yoga supports in the way with emphasis on asana, pranayama and meditation. It calms and centers the mind. It reduces anxiety and depression. It actually makes the brain work better, boost the mood by lowering the stress hormones, increase the production of feel-good chemicals. They are the endorphins, and bringing more oxygenated blood to the brain. And it can decrease anxiety by alleviating levels of brain chemicals called GABA, that is gamma aminobutyric acid. Meditation also reduces activity in limbic system That means the emotions can be controlled. As the emotional reactivity diminishes, we can have a more tempered response. Yeah, only talking business will not do now. It is all about the research works. Research works were happening earlier also. N number of researches have happened. Now also they are happening. I have brought only one work in front of you. It is done in the NIMHANS, Bangalore. The title is Yoga Therapy for Schizophrenia. They have tried the yoga therapy on schizophrenic patients. Dr. N. Gangadhara, Bangalore, and Dr. Shivarama Varamballi are the scholars. And here, this actually is a review study, systematic review. They have collected so many different articles worked on schizophrenia, and that too they have taken yoga as add-on practice with medications, and some without medications also. They have taken yoga therapy for schizophrenic patients. Now the results which they have got are in front of you. They say that drugs used in the treatment of schizophrenia do not yield satisfactory results which were expected by them. Negative and cognitive symptoms remain non-responsive. Obesity and metabolic syndrome coexist with schizophrenia. Patients develop endocrinal and menstrual dysfunction as a result of drugs. This is in case of the drugs. And when the yoga was added as the add-on practice, that showed yoga has demonstrated improved cognition, reduced obesity, metabolic syndrome, intervened positively in menstrual disturbances and endocrine dysfunction. This is obvious. Depression lifts and social sensitivity, the ability to recognize emotions, quality of life improves. So these are the positive effects of yoga on schizophrenia. Now coming to the discussion and conclusion part, mind is a subtle aspect. The yogic culture call it as manomaya kosha. The changes after doing yoga or the person in yoga, the changes manifest in the annamaya kosha, pranamaya kosha, manomaya, vijnanamaya and anandamaya kosha. But we can appreciate the changes happening in annamaya, maybe in pranamaya kosha also, and little bit of the changes can be shown in manomaya kosha also. But what happens in vijnanamaya and anandamaya kosha cannot be so easily documented, or it can be presented in front of the world. So the experiences can be well enjoyed. The experience or the things what are happening in the person can be enjoyed more than they are documented. So coming to the summary, this is the concern that the mental diseases in children is being raising, that too in that age wherein the children should be very much carefree duration or age. The age when it advances, the children will be having more of the responsibilities of the family and other things of the job. They will never be so efficient to deal with all those stress and strains if they are of less energetic in the early age. That is why this is high time that they should inculcate the practices like yoga, which will bring some steadiness to the mind and health to the body also, physical health also will be brought. And so this is advice to the mainly to the children that they should inculcate practices like yoga. If it is done in so small age, as the age advances, the yoga also grows in them. These are my references. Thank you.